Hi, my name is Dr. Amanda from Veterinary Center of Parker, and I am here to talk to you about diabetes in dogs. So let's start with the basics of what's going on in the body. So we eat a good meal, our body absorbs all of that nutrients, we get all of this glucose, which is sugars, floating through the bloodstream. Now, the body uses a molecule called insulin to transport that glucose into the cells, and then the cells use all of that glucose as energy. In dogs, they have what's called type 1 diabetes, which is when the pancreas, the gland in the GI tract whose job is to make insulin, isn't able to make enough insulin as it's supposed to. And without enough insulin in the body, that glucose can't get into the cells can't do their job, and there's a high level of glucose in the blood. So, what are you going to see? What symptoms are you going to see in your dog? Namely, drinking and peeing will increase. You can also see an increased appetite, you can see weight loss, muscle loss, you can see cataracts developing all really suddenly in their eyes. But increased drinking, and increased peeing are going to be your first indicators. So if you notice any of those things, definitely talk to your veterinarian. Now, what is your veterinarian going to do with this information? Just like anytime you bring your dog to the vet, they're going to do a full physical exam. So they're going to look at your dog from nose to tail, look them over, see if they find anything of concern. And then they're going to recommend blood work and urine testing. They're looking for increased levels of glucose not only in the blood, but leaking out into the urine as well. There's a few other confirmatory tests, but that's going to be a good place to start. Now, let's say they've done all this workup and they have diagnosed your dog with diabetes. How are you treating it? You are going to give your dog an injection of insulin under the skin at breakfast and dinner. It's really important to give insulin at meal times because that is when there's the most glucose in the body, and so that is when we need the most insulin. If you give insulin when there isn't enough glucose in the body stores can be depleted and it can cause really detrimental effects to your dog. Also, really important to focus on weight loss through diet and exercise. A healthy weight dog is going to handle diabetes much better than an overweight dog. Now, how are we going to know that this dog is doing better? There's kind of two main tests that we have that your veterinarian will recommend. The first is called a glucose curve, and that's when your dog will stay at the vet for a full day. And every 2 hours, they're going to draw a sample of blood from your dog to look at its glucose levels. Now, before you drop the dog off, you'll have given him breakfast, or her, a breakfast, and their insulin shot like normal. And what they'll see is that the glucose levels are going to go down, and then as that insulin starts tapering off, they're going to start going back up again. We want to see this really nice curve, not getting too low at the bottom and not going too high at the top ends. And that is telling us that we are giving the right dose of insulin for your dog. There's another thing that we could do is attach a device to your dogs after shaving a little bit of hair, and that device will continuously read the amount of glucose in the body. It's a really great option, especially for dogs that get stressed at the veterinarian. And then you would send us that information, and we would go over it with you and make sure we're still giving the right dose. Also, we want to look at your dog. Are they peeing less? Are they drinking less? If they lost a bunch of weight, are they gaining that back? Are they maintaining their weight? Are they maintaining their muscle mass? How is their appetite? We want to kind of monitor all of those things. What symptoms are they dealing with? Are they getting better? And adjust the dose accordingly and continue to monitor. And then, as their caregiver, will want to keep track of when you're feeding them, when you're giving their insulin, how much you're giving, how are they tolerating it, are there other medications that they need to have, and how are we all working with those in conjunction in the body. But really, the ultimate goal is to have your dog comfortable and living the best life they can. And so that's where it's really important to talk with your veterinarian about any concerns you have with their health, with their treatment plan, with their monitoring plan, so that you and your pet and your veterinarian are all working together to make the best decision for your dog. Again, we want to have the best opportunity for you and your dog, so please ask us any of these questions. If you notice anything that's concerning, bring it up to us. If you don't tell us, then we can't help you, and we love educating and we love answering all your questions.